diabetes and type 2 diabetes. But the majority of people, they have type 2 diabetes, which constitute about 90% of most of the world population. And diabetes is a major problem worldwide, affecting millions and millions of people around the world. Diabetes is basically a disease which affects the body in the way how it uses sugar. And as a result of this problem, is mainly either the body does not produce enough insulin, and insulin is needed to make the sugar gets into the cells of the different body cells. And or some people, they have enough insulin, but there is insensitivity to insulin. So the body still cannot use sugar properly. This disease is a serious illness which affects many organs of the body. It affects the heart, affect the kidney, affect the eyes, affect the feet, affect the nervous system, affect the psychology of people, and affect even relationship between a man and a woman. So I think it's really we needed to recognize this illness early enough to prevent complications of diabetes. And the complications of diabetes are many. And the serious one is the heart attacks and kidney failure. And diabetes is the main cause for blindness around the world. And it affects also the feet. You can have nervous system problems. You can have wounds which do not heal. Also, a lot of people have psychological problems like depression, and they can't sleep well. They have serious other issues. Causes of diabetes, I think the major problem of diabetes is the lifestyle. So people who are obese, who don't exercise, and also there is hereditary. It can be from, if you have a member of the family who got diabetes, you are more likely to get diabetes. Some people, they have diabetes in pregnancy, which is a transient state. We call it gestational diabetes. Or some women, they have problem in their ovary, so they're at risk. And people who are sedentary life, who don't exercise, they can be affected by diabetes. And other people, maybe some of the drugs, like the steroids, which you use for if you have rheumatoid arthritis or something like that, they can induce diabetes. There's other risk factors. The main thing is the fat around the abdomen, the belly, which is now considered to cause a lot of inflammation around the body. So these are there are many other risk factors which I don't want to get into, but the main one is the lifestyle. The clear symptoms of diabetes is one, you feel very thirsty all the time. The second thing, you go to the toilet, urination many times, especially at night, and you feel blurred of vision. You cannot see clearly. There are some people who have wounds that don't heal easily, and some people may come to the first time they come to the clinic with a major complication of diabetes, like heart attack. They have diabetes for many years and they don't know they have diabetes. They get heart attack, they come to the hospital, and then they discover they have diabetes. So these are the main symptoms of diabetes. Other symptoms are you feel tired. So if you feel tired, you go to the toilet a lot, especially at night, or you don't see clearly. I think that is the time you should come to the doctor. And the earlier you see the doctor is the better. Because what they discovered, if you delay diabetes, it's like if you have 5 years and you don't know you have diabetes, that is the time you have complications. And by the time the complications appear, it is difficult to reverse the complication. It is easy to reverse the diabetes from the start, but it is difficult to reverse the complications. I think the easiest way, the cheapest way is to be active. And as diabetologists, we recommend that if you want to prevent diabetes, you need to exercise at least half an hour, 5 times per day, walking, brisk walking. This is a very easy way, simple and cheap. And the other thing is to avoid eating too much sugary stuff, like too much sugar, white sugar, bread, rice, you avoid that. And you need to not to eat or drink fizzy drinks like which has got a lot of sugar, fizzy drinks. These are very bad for the health. And to eat healthy food, mainly vegetable or green stuff. You can eat also beans. You can eat meat without too much fat in it. Is a lifestyle thing. Stop smoking. Drink as little alcohol as possible. This helps a lot with prevention of diabetes. I think the best way to do it is to, once you discover that you get diabetes, you need to control the blood sugar, because this is the main cause for all the complications of diabetes. To control blood sugar, you need to have regular tests, and there are simple tests which you can use at home. When you discover that you get diabetes, and you need to take your medication according to the prescription by the doctor, and also as the exercise, because a lot of people with diabetes don't know that exercise is 50% of the treatment. So if I give you a drug for diabetes, this is 50% of the treatment, but the other 50% of the treatment is the exercise. And that is, I emphasize this point because it is not expensive and it doesn't cost anything for you to walk. So this is the best way. So regular checkups, taking your medication on time, and exercise. And medical treatment, it depends on the level of the sugar in your blood. So if you have very high blood sugar, and also what we call the other test we do for the treatment is we call glycated hemoglobin, it is a blood test which tells me in the past 3 months whether this patient under control or not control. So according to the level of this test, I decide. But for the start, if you have diabetes the first time, we start with a drug called metformin, which is a tablet you take, maybe once a day or twice a day, depends on the level of the sugar in your blood. And again, if you have very, very high sugar, very, very high glycated hemoglobin, we need maybe to take 2 or 3 drugs. But some people, when the diabetes has gone for many, many years, and you tried all the drugs, all the tablets you need to take, and they don't work, we have to resort to giving insulin. Because by that time, if you have diabetes for many years, the pancreas, which produces insulin, will be completely dead, and you need to provide external insulin to compensate for that.